Every 20 seconds, a child dies from a vaccine-preventable disease. The resurgence of vaccine-preventable diseases is largely caused by vaccine hesitancy and can be addressed through policy. The recent COVID-19 vaccination controversy has magnified the issue of vaccine hesitancy, which has troubled me greatly when I learned there are people who have these same attitudes with regard to routine vaccines given to children. As a parent and a citizen, I wondered what could be done to improve the rate of vaccinations in children. So I did a lot of research and reached out to various state organizations. I'd like to talk to you about the key factors of vaccine hesitancy, how it's threatening public health of our state and our nation, and steps we can take to counteract this issue. Vaccine hesitancy is defined by the World Health Organization as a delay in acceptance or refusal of vaccines despite the availability of vaccination services, and it is one of the top 10 global health threats in 2021. Hesitancy toward vaccines costs the United States millions of dollars and jeopardizes lives. Vaccines prevent many diseases, but to prevent this presentation from going too long, we are going to focus on the measles, mumps, and rubella vaccine, or MMR vaccine. Measles cases have risen dramatically over the past 10 years, from being declared eradicated in 1992 to dramatically leaping to over 1,200 cases of 2019. 2020 looks good, but don't get too comfortable. This is likely due to people quarantining due to the COVID pandemic. In 2019, measles outbreaks were confirmed across 31 states and cost $42 million to treat. The 2019 outbreaks affected Americans across a variety of age groups. 13% were infants, which represents part of the population that herd immunity is supposed to protect, because the MMR vaccine is not recommended until a child is 12 to 15 months old. 31% were children aged 1 to 4, 27% were children aged 5 to 17, 29% were adults. The other piece of information this chart tells us is that almost 3/4 of the affected population depended on their parents in order to be vaccinated. Many doctors and epidemiologists agree that measles is the most infectious disease on the planet. One infected person can easily spread it to 12 to 18 people. Europe had 18,000 cases of measles in 2017, and again in 2018 due to vaccine hesitancy. This is about 15 times the amount of outbreaks the US had in 2019. If it cost us $42 million to treat 1,200 people, imagine what it would cost to treat an outbreak of that size. To put it in simple terms, according to the WHO, measles is now a global health crisis with a 300% surge in cases worldwide. The herd immunity threshold for measles is between 93 to 95%. And when immunity dips below that level, an outbreak will occur. This is evidenced by a team of researchers that predicted outbreaks would occur in 2019 in the indicated areas based on low vaccine compliance, non-medical exemptions, international travel, and population data. And here's how accurate they ended up being at the end of 2019. Most of Nevada has an 80% vaccination rate for school-age children, but some schools in rural Nevada reflect immunization rates between 57 to 66%. It's no surprise that Las Vegas was the site of an outbreak, given the number of international visitors. The rates for medical and religious exemptions from child vaccinations in Nevada are 0.1% and 3.1% respectively, leaving approximately 16.8 children unvaccinated for other reasons. There are many factors that impact why some parents are hesitant when it comes to vaccines. Researchers often break down the factors of hesitancy into what is commonly known as the 3 C's. Complacency, convenience, and confidence all have overlapping roles in vaccine hesitancy. Complacency describes the faulty sense of security some parents might feel from the dangers of vaccine-preventable diseases and extent of herd immunity. Convenience describes a lack of resources, including access, money, and time. Confidence describes the mistaken trust that people have in public figures, flawed medical studies like the study linking the MMR vaccine to autism, urban legends, distrust of big pharma and the government. Interventions for complacency and confidence are hard to come by. Complacency and confidence both have roots in misinformation. Some complacent parents finally vaccinate when their children enter childcare or become school age. Pediatricians are often unable to unring the bell of misinformation, decreasing the chance of convincing a truly anti-vaccine parent, because anti-vaccine parents truly believe that vaccines are deadly. Anti-vaccine parents are only responsible for 3.3% of unvaccinated children in the US. The opportunity for intervention exists within the group of parents hesitant for reasons related to convenience, or lack of resources. These are parents who may find it inconvenient to take time off work to get their child to the pediatrician, or are perhaps unable to afford medical visits. Children living below the poverty level have lower vaccination rates consistently. Some children live in rural areas far from vaccination clinics. While children of these parents usually end up getting vaccinated because school or daycare requires it, once the child meets those requirements, a parent might put off visits to the pediatrician due to an inability to miss work or incompatible work schedule. No child should go unvaccinated due to a lack of access or lack of financial resources. If bringing children and vaccines closer together is the answer to reducing vaccine hesitancy, we should provide the funding for several public health initiatives to accomplish this goal. When children had access to vaccines at school or daycare, vaccination rates rose. The Task Force on Community Preventative Services found that immunizations increased by 15.5% through the use of school-based health centers, especially in communities that were lower income and had limited insurance. Nevada saw immunization rates improve dramatically by 21% after Immunize Our Children held immunization clinics at child care facilities across rural and frontier Nevada. Funding is needed for school-based health centers and child care immunization clinics. In addition to improving vaccination, school-based health centers also increase health equity for many children, offering physicals, vision screening, treatment of chronic conditions like asthma, addressing mental health needs, and more. Richard Reeves, a senior fellow with the Brookings Institution, has studied school-based health centers and found that they largely serve minority, low-income, and uninsured students. Partial recovery could come from billing health insurers. 85% of school-based health centers are able to bill Medicaid and private insurance. This recovery could be improved by hiring a medical biller, as only 39% of school-based health centers actually bill private insurance. State funding is necessary to support these initiatives. When I talked with Brianne Van Dyne, Program Director for Immunize Nevada, she informed me that immunizations at schools in Nevada are limited because there are not enough school nurses. The School-Based Health Care Alliance reflects that the amount of centers increased from 35% to over 60% with state funding. Sadly, the state of Nevada does not have a legislative mandate to provide funding to school-based health centers. As a result, there are only 10 school-based health centers in Nevada. Public subsidies that allow for more mobile vaccination clinics should be provided for in a similar manner to funding for school-based health clinics. And Medicaid and private health insurers should be billed for those services. If set up properly, this solution could almost sustain itself. Investing in health has proven itself to be a significant payoff. In the US alone, approximately 42,000 adults and 300 children die each year from vaccine preventable diseases. In contrast, vaccines prevent approximately 14 million cases of disease, reduce healthcare costs by $9.9 billion, and save $33.4 billion in direct costs. Just remember the $42 million spent on the measles outbreaks in 2019, and imagine how increased vaccination rates would have saved money. In the words of Benjamin Franklin, an ounce of prevention is worth a pound of cure. Think for a moment what a nightmare it would be if the nation was caught in another pandemic due to the mutation of the measles virus. Now that we are aware of the public health problem caused by vaccine hesitancy, its definition, causal factors, let's do our part to fight against it. It is critical to the health of our country and our children that we take steps to improve vaccination rates. As of the end of this presentation, at least 21 children have died from a vaccine preventable disease. Thank you for listening.